This is week 5 full body assessment, and Chris is my volunteer this week. Thank you. So first thing you want to look at with the general appearance of a person, you want to, can you state your age for me? I know.
52.
But you don't look it, so that's a good thing. That's what Kylie told me her age, and I was like, yeah, you definitely don't look your age either. You look at level of consciousness, skin, nutrition, posture, mobility, facial expressions, and hearing, and then how their hygiene looks. Then you would do measurements, weight, height, if you did a waist circumference, body mass, that type of stuff, and then you could use the Snelling eye chart and check their vision if you would like to. Then you actually go into the assessment, and usually the first thing you check is the skin on the hands and the fingernails, and you just kind of look at that because that's going to be the comparison that you make with the rest of the body. And you can check nail growth, you can also check the capillary refill and all of that, kind of give you a little bit of an idea for later in the exam. Then you would do your vital signs and make sure everything is okay there. From there, then we start the head to toe assessment. So when you're doing that, you look at the scalp, you want to make sure that there's no lesions, that hair growth is distributed evenly, and then you just want to check cranial nerve 7, so smile for me and frown for me. Very good. Lift your eyebrows and show your teeth, and then puff your cheeks out, and I'm going to push on them like when you're kids. And what you want to do when you do that is just make sure that the air is coming out evenly on both sides. So that's what the kids always like to do. And then you check the TMJ, so you find the joint and go ahead and open your mouth and shut it for me. You want to make sure that you're not feeling any clicks, rubs, or anything like that, grinding type of stuff. And then you would check the sinuses, any sinus pressure or anything like that up and through here. I know we're changing weather, so that's entirely possible, but yeah. So you check for that stuff. From there, then you go on to the eyes. You would check the visual fields. You would check cranial nerve 3, 4, and 6. You would look at the eye structures. You want to make sure that they're even and symmetrical. You would check the pupil responses, light accommodation, and the size. And then you would use the ophthalmoscope back here. So first thing I'm going to have you do, just if you can touch my finger and then touch your nose. And I'm going to do that just in a couple spots. Okay. And then, like I said, you're just going to check the eyes and everything. Then from there, it's going to get really dark in here because I don't think they have any of the main lights on. Well, maybe they do. You would darken the room a little bit, and then this is where you would check you would look through there, dial through, and you're going to check for all of the optic nerve and the retina and the fundus and all of that. And you make everybody's eyes water when you do that. It's my favorite part. So then you're going to check the ears. You want to make sure that those are even and that they're aligned. You check the tragus and you check all of the skin. You make sure that they're attached okay. Everything looks good there. So then from there we would use the otoscope. That on, and then you're going to go in and you're just going to check the eardrum, and you're going to look at the tympanic membrane and all of that fun stuff. Go ahead and turn your ear for me here. You want to make sure that it's nice and shiny and no wax and all that kind of stuff there, so it looks good. You're also going to look for the color and position of all of that down in through there. Then with the nose, you're going to check for the position of that, making sure there's no lesions, that there hasn't been any obvious fractures or anything like that. Then you would check the symmetry of the face, and then any breathing issues, you can breathe evenly out of both sides of the nose. Sometimes you have them do a sniff test, which we're not going to do. And then then you would use the otoscope to look up the nose and check and make sure the passages are okay, there aren't any polyps or anything like that. Then you would inspect the mouth and the throat, so you would check the teeth, obviously make sure that there's none that have fallen out or they're rotten, that type of stuff. You would check the tongue, so if you can stick your tongue, you want to make sure that it's midline. You also want to check the color and make sure that there aren't any lesions or anything on that. That also checks cranial nerve 12. Then you would want to, if you need a tongue depressor, but open up and say "ah," you want to check the uvula. You want to make sure that that's in the midline position, that there's no swelling. You also want to check tonsils if they have the tonsils. Make sure those are even, none of them are swelling. Then from the neck, you want to check and make sure that there's symmetry in the neck. You also want to palpate all of the lymph nodes and make sure everything's straight down in through there. You also want to check for any pulsations, the carotid pulses, you can check for those as well. And then you would want to make sure that the trachea is midline, and then check the range of motion. So if you could put your chin to your chest, and then your head back, and then if you could look to the left and right. You just want to make sure that both sides have about the same flexibility. From there, then you would check the posterior part of the chest. So they would be in a gown at this point. So you would have them lean up, and you would want to check their ribs. You would want to make sure that everything looks good, no bruising, anything like that. You would want to make sure that the muscles are even. You would also go through and you would want to palpate the spine to make sure there isn't any protrusions or anything is out of line. And then from that point is when you would listen to the lungs. So I'm gonna listen to you here. Go ahead and take a breath. And normally you would do this skin to skin as well because it's a little easier to hear. You don't have friction from clothes. Okay, and then from there you would have them sit back. You would go ahead and you would watch their respirations. You want to watch for symmetry there. You want to make sure that one part of the chest isn't expanding over another. Then you would want to do any palpations for any tenderness in the muscles. You would also want to check for bruises and all of that kind of thing at that time. And then you would auscultate the breath sounds. So go ahead and breathe. The lower lobes on the front, but normally you would check the lower lobes on the front as well. Then you could also check for any murmurs or rubs or anything at the apex of the heart and at the base by having them lean forward. And you can auscultate, and that sometimes will help bring the murmurs out. Then you would check the upper extremities. So with the upper extremities, you would check the range of motion and all of that. So you could, make a fist. Are they even? Flex your wrists and your elbows, and then shoulders, raise them all the way up, all the way down. Very good. And then for strength, you would have them squeeze your hands at the same time. You want to make sure they're even, and then try to pull up as I pull back. Okie dokie. Very good. Got some arm strength going on. That always helps. From there, you want to check the neck vessels, so you would want to check all the arteries, and you would want to listen for bruits and all of that stuff. Then for the next part, I'm going to put these back on again. And from this part, you would listen to the heart, and you could listen in all 5. And there's a couple more spots down there. I won't listen to the base, but you want to make sure that it's regular and that the rate and rhythm are where they're supposed to be. From there, you do the abdominal assessment, so you would ask about appetite, changes in weight, food intolerances, any difficulty swallowing, how often they have bowel movements, if there's anything irregular about them. You want to know if there's any blood in their stool. Obviously, that could be a big sign for a bleed or something that may need to be taken care of. ask about any operations that they've had. You would want to inspect the abdomen. You would want to see if there were any lesions, any scars, anything like that, any redness, any noticeable swelling. You would want to look for any pulsations. You shouldn't see pulsations in the abdomen. That can be a problem with the aorta if you do. Then from there you would auscultate or listen to the bowel sounds in all 4 quadrants and listen up to 5 minutes if you need to before you determine that someone does not have any bowel sounds in each quadrant. Then you would also listen for the renal arteries and for the aorta. You can percuss the height of the liver. You can also palpate in all quadrants. You can palpate the liver and the spleen and the kidneys, and you can also palpate for an aortic pulsation. Then from there you would go ahead and check the inguinal pulses for the femoral pulses, and you would want to check for any nodes. Then from there you would go on to the lower extremity, and just like the upper, cross your legs for me. You want to make sure that they're about the same height, that there isn't any drawback on the hips or anything like that. You want to check for strength, so go ahead and pull back and go ahead and push down. Very good. Then you would want to check range of motion with the lower extremity. Bend your knee up and then run your foot down your shin. You're also checking for some coordination on both sides there. Very good. Very good. And then you want to check the hip flexors, so bend one of your knees up and then just let your leg drop as far as it'll go down. And you just want to check that that's equal as well, so go ahead and do that with the other side.
Same time?
No, you don't want to. You just kind of want to see if those match and if they're even. Check for muscles and all of that stuff. You would also want to check for varicose veins, and then you would also want to check for the pulses on the upper extremity as well. I forgot those. And you could check your reflexes as well in the elbows, and then at the wrists, and then the reflexes on your knees, and then some on your feet. Pulses, obviously you could check at the wrist, you can check behind the knee, you can check the tibial, and then you can check the dorsalis pedis on the top of the foot. You're alive, I feel them. That's a good sign for circulation down there. I know you were so worried and concerned. So then for neuro, go ahead and close your eyes for me, and then I'm gonna touch your face, and I just want you to let me know when you feel it.
Okay.
Made you jump on that one, sorry. Okay, same on your arms, close your eyes. There. On your legs. Okay, so you check for all of that. You would do the reflexes. The finger to nose can also be used for neuro, the heel to shin, all of that. The Babinski sign on the foot, all of that can be used as the neuro, and you can incorporate that into the assessment as you're going along the different things if you want. Then for the musculoskeletal, if I can have you stand up. And I just want you to take a couple steps that way and then turn around and bring a couple steps back. And at this point, you're just wanting to watch gait, you're wanting to watch their backs and make sure everything is okay and everything is good. Then we're gonna do the Romberg, so go ahead and stand with your feet together, arms out a little bit.
Together?
And then close your eyes.
And what am I doing?
The Romberg sign.
Like this?
Yep, just close your eyes. And very good. You're just wanting to check at that point to make sure that they can keep their balance and everything. Because sometimes when you close your eyes, obviously you don't have that reference and it can make you dizzy. And then you would have them, you can turn sideways so that you don't have your bum to the camera. Go ahead and touch your toes for me. So when they do that, you're also checking alignment. You want to make sure scoliosis. You also are checking for flexibility in the hips. Very good. And then you could also check by the knee bend. If you stand and just bend one leg, you can use the bed if you need to. And then the other, and then go ahead and switch. Use the other. You're just checking for for balance and flexibility there too. Good
Okay.
job. Very good. So we are done with that part of the exam. It's up to you if you want to stay in here for the rest of it, or you
Okay.
can go ahead. It doesn't matter. Whatever you want to do.
Okay,
So,
well, how did I do?
thank you. You passed everything. So, all right. Good job.
Okay.
I'll see you here in a minute.
Okay.
All right. So from that point, I'm going to explain the breast exam for the male and female, as well as the male genitourinary system and the female genitourinary system. For the breast exam for females, you want to ask about pain and tenderness, if they've noticed any lumps, if they've noticed any discharge, if they've had any rashes, if they've noticed, again, swelling, or if they've had any trauma to their breasts, if there's a history of breast disease in their family. If so, you want to know the type, you want to know when they had it, and you want to know if they had treatment or what that treatment was, if they would have any surgeries, and then you want to ask them about the self-exam. You would also examine, you would look at the appearance, check for lymph nodes, you would look at the nipple, and then you would palpate for any lumps, lesions, cysts, or anything like that. And then from there, depending on their question to the self-examination, you could teach that. The self-examination, usually between ages 20 and 39, you want them to be doing the breast self-examination, as well as having a clinical breast exam every 3 years. Once they hit the age of 40 and they're older, you want them to do the breast self-exams once a month, as well as having the clinical breast exam every year. And then also, you would also start the mammograms around that time, get a baseline, and then go from there as well. And that is just to detect any changes, any cancer or disease that may be present in the breast. You would also want to teach them when, which is usually right after the menstrual cycle, or they could also do that between days 4 and 7 of a menstrual cycle. If they have a longer period, that's when the breasts are least swollen and you can actually feel what's going on in the breasts. For the male, you basically are going to inspect the chest wall, see if they have gynecomastia, and then you're also going to palpate for lumps, lumps or cysts or anything like that, and just check for that. The male genitourinary system, you want to ask about urinary frequency, urgency, if they have any pain when they urinate. You want to look for the color of the urine. You want to know if it's cloudy. If there's any blood in there, you definitely obviously want to know that. You want to know if there's any past history with themselves or if there's any in the family. You would want to ask them if they have any pain or lesions or discharge from the penis at all. You would also want to ask about lumps or swelling to the scrotum. So you would inspect and palpate, which would check for hernias. You also want to feel for the lymph nodes. And then you want to ask them about the self-care testicular self-examination. They should be doing that starting around the age 13 or 14, which can be uncomfortable for a kid to talk about, but it's something that needs to be done. You would explain to them that they could do that just once a month when they're taking a shower, set a day, whether it's the first day of the month or the last day of the month, just to check. You just want to make sure, again, that there aren't any changes, that they're not noticing any lumps, that there aren't any bumps or lesions, the skin color and all of that. And normally the testicular cancer will peak between the ages of 20 to 39 years old. So definitely during those years, they want to be aware of what may be going on and what changes may be happening. Then you would also check the anus and the prostate. You would want to check for any rectal bleeding. You would want to ask them definitely about if they've noticed any blood in their stools or if they're black. That again could be a sign for a GI bleed or a serious issue that's going on. For the female genitourinary system, you want to ask them about menstrual history, when they started, how long their cycles are, how heavy they go, if they have cramping along with that. You want to ask about menopause. You want to ask if they've had any urinary symptoms, if they're burning, if they have frequency. You would also want to ask them about vaginal discharges, any past history. With both the male and female, you want to ask them about sexual history and contraceptive use. And if they are taking precautions to protect themselves from STDs, if they've ever had STDs or been treated for them. For the female, you want to know if she's had an annual Pap exam and had a smear to check for, cervical cancer and different diseases of the cervix and of the vagina. Again, you would inspect. They would be laying on the bed, have the stirrups. You would use a spiculum, and you would look at the cervix, and you would want to check for any cysts or any bleeding that's going on there. You would want to check the vaginal wall and make sure that there, again, aren't any lesions or bumps that you're noticing. You would want to do a bimanual exam, and you would check the uterus as well. You would take any cultures that would be a part of that, whether they ask for STD cultures or just regular cultures that can detect the cervical cancer or any other issues that there may be. You would want to palpate for any tenderness, swelling, discharge. You would want to notice any foul odor, if there were any foul odors or anything going on. And you basically, just want to make sure they're healthy. You want to make sure that you do educate them on the importance of having the Pap yearly, and for the male to have their exams, colonoscopies when those start. You basically just want to make sure that you are giving them all of the preventative steps that they can in order to keep themselves healthy, and to remind them that early detection is the best kind of protection for their health and what may be going on. And just for them to be aware of their own bodies and what may be taking place in the changes that are either happening, or that they also know based on age what changes could happen, just so that way there's no worry when things happen. It's a regular, normal aging process. And that concludes my full body assessment for week 5.